For the test evaluation, I did the clinical evaluation of Language Fundamentals, the 4th edition, also known as CELF-4. The authors are Eleanor Semel, Elizabeth Wigg, Wayne Seckard, Tim Hannon, and the publisher is Pearson. The date of publication is July 26, 2013. The CELF-4 is designed to assess the possible presence of a language disorder or delay using a flexible and comprehensive assessment approach. There are many subtests in the test, and they're designed to assess the following: eligibility for services, identification of strengths and weaknesses, performance within tasks related to the standard educational curriculum. There are a total of 18 subtests, but not all are administered. It's administered based on the age of the students, and more. The main overview of the subtests are based on morphology, internal structure of words in the meaningful parts, and syntax, how words, phrases, and clauses are structured to provide meaningful sentences, semantics, concerned with the meaning of the words, pragmatics, the use of the context in which language is used, and phonological awareness of the sound and structure of the words. There were a few different variables considered in the normative summary, and one were that students with disabilities were included in the normative sample, meaning the overall scores have lowered. This means that children will only be identified as having a disability when they score a substantially lower score than their peers, causing less children with mild disabilities to be identified. The age range of the CELF-4 is 5 to 21 years old. On to the reliability of the assessment. The reliability types addressed were test-retest reliability, inter-examiner reliability, inter-item consistency. On the test-retest reliability, the results were insufficient. Inter-examiner reliability, all but one subtest met the standards for reliability. Inter-item consistency, 4 out of the 12 subtests did not meet the standard for reliability of the 12 subtests that were addressed. Across the age ranges during the test-retest reliability, they did not use the entire age range administered in the CELF-4. So they did not do the 5 to 21-year-old age range, making it insufficient to measure. The inter-examiner reliability showed the most reliable results ranging from coefficients of 0.88 to 0.99, which is very reliable. This test can be reliable if measured using inter-examiner reliability, having many trained test administrators rate this test. On the validity of the exam and how valid it is, the validity scored were content validity, concurrent validity, and construct validity. On content validity, analyzed using literature review and feedback from focus groups, unsure if there's no biases, validity considered insufficient. Concurrent validity, the extent to which the test agrees with other valid tests for other tests that measure the same ideas. CELF-4 was measured to the CELF-3 in this situation. This was proved invalid due to the poor diagnostic accuracy and the lack of access to the full age range. Construct validity assesses if the test measures what it purports to measure. This was shown to have a lack of validity. The overall validity of the test shows that it does show some biases. It also shows insufficient findings due to the lack of age ranges being shown through the procedures when they were testing for the validity. On the scoring of the test, a scale of 100 is average. A standard score of 70 or less than 70 suggests a severe impairment. A standard score of 71 to 77 suggests a moderate impairment. A standard score of 78 to 85 suggests a mild impairment. Test scaled scores are used to compare the student's performance to the typical performance of the same age norm group. These scores are derived from total raw scores for each test and are on a normalized score scale with a mean of 10 and a standard deviation of 3. Scaled score from 1 to 7 is shown as weakness or below average, with a corresponding percentile rank of 1 to 16. A scaled score from 8 to 12 is described as average, with a corresponding percentile rank of 25 to 75. A scaled score of 13 to 19 is described as a strength or above average, the corresponding percentile rank of 84 to 99. Age equivalent scores are by subtest scores. The modifications and accommodations of the assessment for children with motor and sensory impairments, their test results come back invalid due to unfairness. For a child with physical motor disabilities, cerebral palsy, etc., they may have difficulties pointing out attending pictures for an extended period of time. Therefore, these results would come back as invalid. For a child with visual impairments, they may not be able to fully see the test stimuli, which causes it not to reflect on their actual abilities, which also, once again, that would come back as invalid. For students with limited English proficiency, modifications and accommodations must be used for children who are linguistically or culturally diverse. This includes an increase in response time, increasing number of trial items, supporting test results with language sampling, and observing child in the classroom. There were biases found in this test for students who have limited English proficiency. For children from a low socioeconomic status, they tend to have a lower vocabulary proficiency than those with a high SES background. There were biases found in the test for children who come back from low SES backgrounds. A study by American Speech Language Hearing Association found in many similar characteristics from students who have taken the test that have a specific language impairment and children who are learning English as a second language, causing false diagnoses. Studies claims that the CELF-4 does contain some inherent biases. The pricing of the assessment. The test is founded on Pearson, with a price of $138. For the examiner qualifications. For the CELF-4, the people who can administer the test are speech and language pathologists, school psychologists, special educators, and qualified diagnosticians that have a master's degree or certification in standardized testing. I currently am not qualified to administer this test. I would need to finish my undergraduate degree first in elementary education and a concentration in special education. I then will take a master's program to achieve a master's degree in special education. And then after that, I will be qualified. Administration, scoring, and interpretation. The administration and scoring of this test seems pretty simple and easy to follow for the most part because it seems pretty similar to other standardized tests. It also seems well designed due to the similarities I saw in the CELF-4 scoring and other standardized tests, scoring and administration I have seen. The test can be administered in 30 to 60 minutes. A review of the test I found on Mental Measurement Yearbook, and it said, quoted, "The CELF-4 is intended as a diagnostic tool and it is used by clinicians for exactly that purpose. That the sensitivity has been proven as one of the strengths of this test, as the clinicians are most concerned about the accurately identifying children with language problems, particularly when funds are limited, as they most often are. The test authors and developers have provided us with a strong tool that can be linked to a classroom language performance." Hayward, Stewart, Phillips, Norris, and Lovell. This was once again founded on Mental Measurement Yearbook. They claim that this test is a strong tool to find diagnosis for children with language and linguistic learning disabilities. And here are my citations. Thank you for listening and learning more about the Clinical Evaluation of Language Fundamentals, 4th edition.